I've never known conditions to be so dreadful in all my years of nursing. We're constantly filling in the gaps.
It's not enough to live on. It's not enough to live on.
This year, my current CMHT is funded for 6 nurses. I've had 3 off sick and been unable to fill those vacancies. That directly impacts on patient safety and the care we're able to provide to patients.
These are the voices of NHS staff, now considering a national strike for the first time since the 1980s. Among them, thousands of ambulance workers and nurses.
Enough is enough. We want to protect our patients. We want to make a difference. We want to do our jobs properly. But at the moment, the pressures that we're facing in terms of targets, staffing levels, increased use overcapacity in services, we can't do that.
We've got crews, running around hours and hours without anything to eat, drink. We're struggling to finish on time. It's absolutely horrendous out there. They just do not listen. The government is not listening. We have been telling them that we're short-staffed. We've been telling them that we're underpaid. Nobody listens to us. So the only way now is to take that action. And trust me, nobody wants to do it.
Today, in a statement, the government said, "We are giving over 1 million NHS workers a pay rise of at least £1,400 this year, as recommended by the independent NHS pay review body, on top of 3% last year when pay was frozen in the wider public sector. Industrial action is a matter for unions, and we urge them to carefully consider the potential impacts on patients." But the unions say it's the staffing crisis that's having the biggest impact.
We've got blood supplies running low because there aren't enough staff to run the sessions. And we've got people leaving day after day for better paid jobs elsewhere. And there's 7 million patients waiting for treatment. So something has to be done to improve pay so that we can get more staff in.
Around 350,000 staff will now be balloted across England, Wales and Northern Ireland. And if a deal can't be reached, the NHS could be heading for walkouts this winter. Layla Hayes, 5 News.